All right. So obviously we're in the midst of a pandemic, and what we're going to be talking about today is designing with vulnerable people to make the right impact. And amongst COVID, we need to think about not only how we react to this health pandemic, but providing holistic and proactive support that considers broader impacts for people's situations. Notice we've called out people, not patients. We are purposely not just looking at healthcare, but throughout this talk, we're going to be pulling in things so that you can look at people holistically. Let me start with the story of one such person. I was conducting research at a local hospital here in Sydney, where we were conducting an ethnographic study into planned surgical procedures. One woman sat quietly in a paper-thin gown without her hijab amongst mixed company. After getting her consent, I began to interview her. She was a mother of 7 children who was there for a third time to get a hysterectomy. The previous 2 times her surgery had been canceled by the hospital. Her eyes began to well up with tears as she told me that she was scared because she would never be able to have a baby again. I was there when the NUM came in, the nurse unit manager, came in and told her her surgery had been canceled again. She would once again have to organize childcare for her 7 children, and even more difficult, preparing herself emotionally for a surgery that would take away her ability to have children. It's in these situations where it's important to think about patients as a person, coming from their own circumstances and vulnerabilities. Hi, I'm Chloe, and this is me and my beautiful family. I'm passionate about this topic because I'm a proud Black woman wearing my diversity, often from a marginalized and therefore vulnerable community. I've also had lived experience with persistent vulnerability, which we'll get into more in this talk. I've worked with survivors of assault and child sexual abuse, veterans, people that are homeless, people that are unemployed or underemployed, and chronically or terminally ill. I tell these stories of the people that don't have a seat at the table that I, in this position of privilege, get to talk to executives and teams of multinational companies. This has led me to find my purpose at work, to become the voice for a voiceless.
Hi, I'm Tash. Chloe and I are old colleagues who work as user researchers and service design consultants. And both of our passions have led us to this topic of vulnerability design. My mantra is using design to make a difference. So working across industries as a consultant comes with the amazing opportunity to bring cross-sector learnings from nonprofit, corporate, private, and public sector to solve big, hairy problems. Together, I feel we can pull our resources and learnings to really make a difference through the products and services we provide. But at the heart of why we're here, it comes down to people. That's what gets me out of bed in the morning as a designer, as a consultant. Personally, I've spent the last few years focusing on how we design services, both digital and physical, for people such as TPI veterans, totally and permanently incapacitated, people with a disability, people who are homeless, people in financial hardship, people who've experienced mental health and domestic violence. Many of those vulnerabilities have been exacerbated by COVID-19. Designing for complex vulnerability should really be just as important as designing for accessibility in healthcare.
Throughout this talk, we'll give you 3 key challenge questions and then 3 key takeaways. This leads us to our first challenge question. How can we better understand and define vulnerability? Often, vulnerability is referred to in the circumstances of crisis and dealing with natural disasters. This is one example of this. Vulnerability can be defined as a diminished capacity of an individual or group to anticipate, cope with, resist, and recover from the impact of a natural or man-made hazard. Whilst vulnerability can be defined, we recognize this isn't the only definition. We like this definition because it talks about anticipation, coping, resisting, and recovering, not just about the hazards we experience, but how we respond to those hazards and build resilience. For those that are a little more analytical or right-brained like myself, don't worry, we have an equation. Vulnerability equals hazards or imminent risk or possibility of a threat minus coping. So what is a hazard? A hazards are when someone experiences danger or risk of social or physical and emotional harm. The intensity of a hazard is based on the following. The probability of experiencing this hazard. During this pandemic, a lot of people are facing losing their jobs. The primacy or shock value since previous occurrence. Have they previously experienced job insecurity, changed careers, lost a job? The predictability, so the warning that a person has to prepare. Was there any warning that they may lose their job? In many cases, there wasn't any warning. No one knew this pandemic would hit. The prevalence based on the extent or duration that a person has experienced this hazard. How long were they unemployed for? As well as the impact or pressure that this has had on their circumstances. Was this their only source of income? Perhaps a migrant that's not eligible for JobKeeper or job seeker programs. Then we have coping. So what is coping? Coping is someone's ability to respond to a present or future hazard, and how we respond either personally or through private and public action to avoid, ensure, and prevent the mitigation of that hazard. So it's really about the person's ability to come up to meet that hazard and then overcome it. And what we've learned is that resilience is something that you build up over time. People have exposure to multiple hazards and have experienced persistent hazard over an extended period of time, actually have a larger wealth of resilience. But while this persistency can help us build resilience, since we know we have overcome it once and we can overcome it again, it also can wear us down.
So as the second wave of the COVID-19 pandemic unfolds in Australia, we're navigating our way through this new normal. We encounter persistent hazards of social isolation, financial hardship, and overcrowded healthcare. So amid COVID-19, vulnerability groups are being challenged. They're no longer just elderly people, those with ill health and comorbidities, or homeless and underhoused people, but this definition of vulnerability is extending. It's extending to people who are struggling to cope, whether that be financially, with more than 2.1 million people in Australia either losing employment or leaving work since March. Mentally, with 78% of people reporting that their mental health has worsened during the outbreak, or physically, with 23% of people saying that they were delaying care as a result of the COVID-19 pandemic. Our previous conceptions of vulnerability are being challenged, and we've needed to rapidly identify what groups might struggle to cope so that we can provide support. So to proactively design for vulnerability, we need to increase people's ability to cope when they encounter hazards. We have an opportunity to not only ensure people have timely access to services from the first moment they encounter vulnerability, but to potentially prevent some of them entering or heightening their vulnerability in the first place. So ultimately, coping starts with access to basic resources. So this wellbeing framework that we're about to take you through has been developed from consultation with government services to help outline what holistic support looks like to service people who are in vulnerable circumstances and increase both their ability to cope and increase their ultimate well-being. So if we think about COVID, to absolve crisis situations, we need to connect people to basic resources. So this is food, accommodation, clothing, medical treatment, education. And it's not just for themselves, but it's also for their family and other dependents. The next element of the wellbeing framework is around emotional resilience. So once we've provided them access to basic resources, we can build up their emotional resilience as they've had these physical needs met. We can re-engage their mental belief and also their self-compassion. This resilience ultimately informs people's ability to be able to adapt to stressful situations or crises, and also grow insights on how to avoid such situations in the future. More resilient people are able to adapt to hazards and adversity without lasting difficulties, whereas less resilient people have a harder time with stress and life changes, both major and minor. The third tier of the framework is around social support. Being socially included refers to people having the resources, opportunities, and also the capabilities that they need to be fulfilled. So this includes engaging with people in their support network and be connected to local services and activities. Connection to social support, whether that be through virtual or physical channels, is critical to prevent recurring vulnerability. So when we talk about providing holistic services, what we're ultimately trying to do is help shift people from vulnerable to empowered, and ultimately help shift people from crisis to empowered. Empowered means they can break this cycle of vulnerability to improve their circumstance and the quality of life through developing positive coping strategies. So we have two more components of this wellbeing framework, which are absolutely critical to help build component. And the first is around increasing people's literacy. So during COVID-19, we've seen shifting mindsets in Australia towards people's openness to technology and also their willingness to share data. Whilst this has rapidly increased the digital literacy of our population, we must ensure that the most vulnerable populations have not been left behind. Increased literacy can also help people understand and negotiate the different services and products that are available to them based on both their current and their future needs. Paired with financial education, this creates greater independence and reduces vulnerability. The last step is about helping people live past their vulnerability, and we do this through professional self-esteem. We want to help people find their purpose and identify the goals they need to achieve to reach that purpose and ultimately become more empowered. Self-awareness and high self-esteem can help people to engage professionally. And we want to help them move beyond just using their network to live with their vulnerability to actually giving back and contributing to society. So ultimately, the Wellbeing Framework captures the holistic needs we must support so that we can build people's resilience and build connected services. We're not saying that you can stop vulnerability. That's going to feel different from person to person. And some hazards are out of our control, but we can limit its impact. And you'll just note on the top right-hand corner of that screen there, we've got a little camera icon. So where we have got a bit of information, feel free to take a screenshot as we're going through, but I believe the slides are going to be shared afterwards. So moving on, how can we support vulnerable people both during, post, and into the COVID-19 recovery? So ultimately, we need to prepare, respond, and emerge stronger from COVID-19. Whilst our immediate goal is to reduce the number of people in vulnerable circumstances, we need to think about how we can start redirecting support to those that need it most. So we've broken this down into 3 key stages. Short term, we've focused on react. This has been about opening support mechanisms for people in vulnerable circumstances to a much larger cohort. So working with a telecommunications client last year, we previously had 5 to 20% of people accessing support, such as deferring bills and access to additional data and calls where there were strenuous circumstances. This number has since increased significantly, with over 3 times the number of people accessing some form of special support since March. In the midterm, we need to move to respond. It's important to acknowledge the risk of deepening health inequalities if vulnerable groups are not properly identified. A one-size-fits-all model will no longer be appropriate in this next phase of respond, and we must assess the members of society that are vulnerable to fairly support those which are at the highest risk. Primarily, we will need to ensure that intensive servicing models are still available for these people that need it most. And in the long-term response, it's about rebound. The implications of COVID-19 on the healthcare system will likely be long felt. However, we can use this experience of dealing with a crisis as a way to consider sustained improvements to our healthcare based on the connections established and modified across the healthcare system. So as an example of this, 88% of consumers who used telehealth for the first time during the pandemic said they would use it again. We can review our crisis response to help inform new models of care and refocus availability so that we can reinstate prevention mechanisms to those people that are most vulnerable.
So whilst COVID-19 has increased the scale of vulnerability, there are some common hazards and populations associated with vulnerability. We're all going through a hazard right now. Being able to rebound, we will need to consider these hazards. And there are 4 types of vulnerability. We have physical, such as quarantine and isolation and being confined to your own space. Economic, people's access to finances, such as loss of job and entry into financial hardship. Environmental, such as bushfires and other natural disasters. COVID is an example of this type of vulnerability. We have social, which is systematic, such as systematic racism and slavery. The lack of fulfillment of basic human rights and social equity. Vulnerability is complex and it's not necessarily straightforward. It's not always evident and it's not always who we think it is. We don't even touch the surface of transgenerational trauma in this talk, but it's a topic almost as big as vulnerability itself. In these pictures are my daughter and her grandfather 3 times removed who was a slave. We need to recognize that there are some cohorts that have increased likelihood of experiencing vulnerability. So how can we identify it? This is another good one to take a snapshot of. We're not going to go through it in detail, but just be aware that there's a lot of examples in here. So go ahead and take a snap. This was created in conjunction with the government agencies. It's not an exhaustive list, rather just gets us in a place of understanding different experiences of vulnerability. This table echoes some of the traditionally vulnerable populations. But when we think about vulnerability, we carry our own biases. For example, homelessness. It's not just rough sleeping, it's couch surfing. Financial hardship, it's not just the loss of a partner or bankruptcy, it can also be separation when you have financially depended on someone else. Abuse, it's controlling behavior, human trafficking, and trauma. Most of us would have either been in one of these situations ourselves or within one degree of separation. To recap, we need to take proactive responsibility for people in vulnerable circumstances to understand their individual needs. We have a gap in vulnerability services that we design because we design for crisis, and we need to be proactive. In understanding and defining vulnerability, we can use this framework to think proactively. We need to think about the different types of vulnerability and what occurs when people are exposed to multiple hazards. In healthcare, you deal with vulnerability every day, but there are additional layers to vulnerability based upon exposure to hazards and people's ability to cope. So this brings us to our next section. Are we designing holistic services that take personal circumstances and vulnerability layering into account? While we might be designing one piece of the service for a person in vulnerable circumstances, we need to consider if their needs are holistically met, because otherwise our service isn't going to have impact. And if we look at vulnerability and its relationship to time, there are two key considerations. One is structural or aesthetic chronic state, such as permanent disability, homelessness, survivors of abuse. The other is proximate, a change in situation, such as returning veterans, released from prison, and fleeing domestic violence. Ultimately, it's a combination of these factors that determines vulnerability alongside people's ability to respond to hazards and adapt to change. According to the Australian Institute of Health and Welfare, 1 in 23 Australians will experience deep and persistent vulnerability in their lifetimes. However, in reality, it's much closer to 1 in 6 of us will experience some form of vulnerability in our lifetime. And this isn't even taking into account what we're going through right now in this pandemic. Multiple hazards over time equals persistent vulnerability. Circumstances can compound. Anticipating future hazards becomes more difficult. Entering crisis becomes more frequent, and it's easy to become stuck in a vulnerability cycle. Persistent vulnerability can wear down our capacity to cope or resilience, and this is what creates a crisis situation. Therefore, we need to intervene before vulnerability compounds and make sure that we are treating all layers of vulnerability, providing holistic services so that we can help people cope.
So by understanding people's context and using their data and information effectively, we can not just identify, but predict vulnerability with significant accuracy, meaning we can better design and redirect services to those that need it most. We need to approach proactive and preventive design carefully, however, as there is a risk of us identifying someone as vulnerable before they realize it themselves. This responsibility means that we need to have ethical principles in place and be equipped to prepare a service delivery response on the back of dealing with people in such circumstances. In the example on the right, I was working with a client to design pilot services for people in financial hardship and homelessness. We asked 6 simple questions which aligned to the key vulnerability types and hazards to capture people who had previously experienced or at risk of experiencing vulnerability. From these questions, we were able to recruit 12 people to help us co-design a future servicing model. Of the 12, we had 10 who were currently experiencing and/or had experienced homelessness in the last 6 months. We also had 5 of the 12 people escalated for emergency support. We were able to identify with incredible accuracy people at their most vulnerable, and we were lucky that we had the right support mechanisms in place. At the end of the pilot project for this client, we actually had 90 data points linked to financial hardship and homelessness. We could detect people who were vulnerable with 86% accuracy and predict people that would become vulnerable with over 70% accuracy. Using this data, we were able to create 2,000 positive interventions for people experiencing vulnerability within a 2-month period. So how might we apply this to the health context when we think about the wealth of data which is available to us? Smarter use of data and analytics combined with predictive modeling methods can provide a more comprehensive and accurate picture of customer needs, vulnerabilities, and expectations. Considering that healthcare is at the core when people are vulnerable, it can also identify customers with exceptional needs and that complex vulnerability that organizations would otherwise be unaware of, and tailor an approach to ensure that these customers are included and supported holistically based on their circumstances. In our recovery from COVID-19, we need to increase access and relevancy of services. So in the model on the right, which depicts the equity of access to healthcare for people in vulnerable circumstances, we can see that accessing this care isn't only defined by people's circumstance, their gender, their geographic location, their accommodation, but it's also defined by their expectation. And this is why it's really important to pair data with personal information and context, because it's also about their ability to perceive their healthcare needs through to their ability to engage and utilize healthcare. And we need to use this information to provide them support in the right way. So I'd like to take you through two examples now, which both demonstrate designing for vulnerability with holistic support services. So on the left, we have Ask Izzy. So this was a website initially designed for people in homelessness, but it's now being used for holistic support, not only for people in vulnerable circumstances, but also for service providers to help identify what is available to them in their area. It's a tool for visibility and awareness, and it's a tool to help direct people to additional support that can improve their holistic situation and also reduce the likelihood of them representing in their care. On the right, we have Safe Haven Cafe. So for those that are down in Melbourne, this is a link to the St. Vincent's Hospital. It's a face-to-face location where people can feel comfortable. They're in the warm, they can have a tea or a coffee, and they can improve their social connections with the local community by chatting to others or a social worker. So previously, people with poor mental health might present to the emergency department with fear of self-harm, and they're restricted to a room for hours, often with no company. Through the Safe Haven Cafe, people have a safe space they can share their emotions and go to when they have nowhere else. The new virtual setup, which was launched in July, allows the team to continue being there during a period that is testing mental resilience for a lot of people. And the annual monetary benefit of the reduction in mental health-related emergency presentations was just over $225,000 from the Safe Haven Cafe. So to recap, are we designing holistic services that take personal circumstances and vulnerability layering into account? Ultimately, it is the combination of personal and circumstantial factors that determines vulnerability. And it is ever present that we need to factor vulnerability into all facets of our design. Vulnerability layering often requires support outside of one service, meaning connected and considered care is ever so important.
So our last challenge question is, how do we involve lived experience to better understand people's needs and build empathy as designers? As designers, we have the power to impact decisions that determine people's lives, and we need to make sure we're doing this in the right way. This is a great quote from Brené Brown, who has a wonderful TED Talk on vulnerability. Our job as designers is typically as storytellers, researchers. We capture stories as data and communicate these to the person that can affect change at each organization. Now, I'm not normally one to go against Brené, but it's not enough just to be a storyteller. We have to involve those who have lived experience to be a part of the design process and designing the services and products that they themselves are going to use. So a combination of empathy and lived experience is required. Empathy is a known requirement. Ultimately, we need to involve the right people at the right time in the right way. This highlights the complementary nature of some of the risks and benefits in empathy and lived experience in this chart. For example, while one risk of empathy is that as designers or other actors, we gain a superficial understanding of a person's needs and experiences. The benefit of leveraging lived experience is that actors offer specific, situated understanding informed by their inherent contexts. Similarly, the integration of lived experience and co-creation has sparked the need for role renegotiation between actors. And it's through empathy that the others experience disruption and conflict, which can facilitate role shifts. The application of either empathy or lived experience within co-creation relies on the existence of the other. One cannot truly have empathy unless it's been formed by lived experience. And the use of lived experience in co-creation requires the integration of particular skills and knowledge from an empathetic other to realize the valuable innovations that are of mutual benefit.
So when we involve people with lived experience of vulnerability, we need to develop an authentic two-way relationship. It's not enough to just involve these people in our research. People with lived experience and lived expertise need to be embedded in our teams and in our ways of working. We need to go beyond empathy and support them to move past their vulnerability. So this framework that you see on the right was one that was developed by a leading Australian charity in partnership with Glover and Hodges. It talks about how we can give back and help people with lived experience and expertise to manage their life adversity. For me personally, this was a real eye-opener. When previously conducting engagement with people who had lived experience or expertise, I would always provide a recruitment incentive, and I really advocated for that to be something substantial and fair. But what I found was that participants are more interested in being supported to share their voice and better understand both their rights and responsibilities. Therefore, both are absolutely critical when planning co-design and engagement. People who have navigated lived experiences are uniquely placed to role model, mentor, and sometimes challenge others in their experiences and how they can move past it and overcome some of their situation. This is where it's so important in learning from and with each other. They can help, and we can help them in how to advocate, voice their opinions on decisions that affect them, but also learn how to negotiate power to advocate for the broader vulnerability group that extends beyond their own circumstances. And ultimately, we want to help people live beyond their vulnerability. This is absolutely critical, and this is part of our role as designers and researchers, to not only design the services which can help better their situation and help better the situation of others which are experiencing similar vulnerabilities, but to help them move from lived experience to lived expertise. So what is the difference between lived experience and lived expertise? There is a clear difference in these definitions, and we must include both cohorts when we conduct user engagement and research. Part of the risk that arises from only including lived experience comes from what's called an empathy gap. So this is where you have less empathy of something when you've been through it before and compare solely with your own situation. We bring our own biases around what people should be able to handle based on our level of resilience. So one, people generally have difficulty accurately recalling just how difficult, painful, stressful, or emotionally draining a past adverse experience was, particularly due to recency or inability to talk beyond their lived experience. Secondly, people who have previously overcome an adverse experience know they were able to successfully overcome it. And this can give the perception that the event can be conquered and they can have less empathy for people that might still be struggling through it. So that's why we need to involve lived expertise, people who have experienced a circumstance and know how to talk about it and advocate, and lived experience, people who can test and validate potential services based on their current situation.
So this brings us to our final takeaway. Empathy is not enough. We need people both of lived experience and lived expertise to be involved. So here's our contact information. Feel free to reach out to us. And additionally, there's our 3 key takeaways. 1, we need to take proactive responsibility for people in vulnerable circumstances to understand their individual needs. 2, we need to design holistic services which provide people additional support based on vulnerability layering. And 3, when designing with vulnerable people, please always include people with both lived experience and lived expertise. So I want to finish by telling you a story. And I want to start with the ending. I am happily married, as you saw before, with a wonderful husband and a beautiful 2-year-old daughter and a sweet 10-year-old stepson. But 5 years ago, my world was shattered. My partner at the time died tragically and suddenly. I had a miscarriage, and a dear friend who served as a Marine committed suicide. This happened all within the space of a month. I was rocked to my core. I was hurt. I was vulnerable. But I was still in the community, engaging in services and products that I would engage with every day, probably even more so, because it was at that time that I needed connection. I needed to be connected to something bigger than myself. It was then that I realized that the experiences that we're designing with that were designed with me in mind. And I mean me not as a number or a dollar sign or as a patient, but as a human, were the experiences that I managed to find connection in. The people, the employees that managed to smile at me and ask me how I was going, not out of obligation, but out of care, stayed with me. It's moments like these that we create moments of healing. That at our most vulnerable, we are still human. This is why Natasha and I designed for people in vulnerable circumstances. Thank you. So I think we have one question.
Yeah. Thank you so much for that, Chloe. Thank you, Natasha. That was fantastic. Really appreciate it. That was a good talk. Look, I mean, the only question that I have really is just that, is there any sort of resources or sort of guidelines that you guys sort of follow that's available for the community?
Yeah, it's a good question. And we get asked this a lot. I know in terms of training, there's some really good resources available at the moment, which I know some of our team's going through in terms of mental health first aid and also trauma-informed care. And I believe they're discounted at the moment. So I know Black Dog Institute does some and a couple of others. They're not...
Blue Knot Group.
Yeah, Blue Knot Group. So they're not specific to UX, but there's definitely some applicable principles in terms of dealing with people in those situations. So I'd highly recommend that.
Definitely. Yeah, I'm trauma-informed trained, and I definitely recommend that from Blue Knot.
Okay, brilliant. Thank you. If you could, I mean, any resources, any books that you guys have, by all means, please share it on our Slack group. We'd really appreciate it.
Sure.
And just sort of finally, have you guys got sort of buy-in from government with regards to what you're doing?
Yeah, it's a good call out. So a lot of the examples we talked through are ones which we've co-designed with government. We didn't talk to it in this particular presentation, but there is a project that Chloe and I have both been heavily involved with called the Constellation Project. And as part of that, we've both had a really critical role in terms of defining what are some of the mechanisms for engaging lived experience, but also what are some of the data models and identifiers which we can use for people in vulnerable situations. So as part of that work, we've been engaging government, nonprofit, corporate sectors, so really kind of a wide range of different organizations to understand how they approach vulnerability design as a topic, but also how we can start to consolidate and unify some of the approaches that we have. So definitely still an ongoing process, but getting there with kind of every talk that we do on vulnerability design.
And the Constellation Project, for anybody that's interested, is an effort to end homelessness in a generation in Australia. So it's a really good, worthy cause to get involved with if you can.
Okay, and just with regards to your data that you guys are collating, I know one of your slides you said that you could identify with up to sort of 72 or 74% of people that will become vulnerable. I mean, how did you collate that, or where does that data come from?
Yeah, so that was based on a project that we did looking at some of the qualitative identifiers of people who were experiencing different vulnerabilities. So we started by looking at people in financial hardship. We then looked at people in homelessness, people who were experiencing mental health, family and domestic violence, so a number of different kind of vulnerabilities. And we started with that qualitative identifiers. So like you kind of saw in that screener survey, we asked a couple of key questions to try and get people who we thought might be experiencing those circumstances. From there, we asked them, sort of using customer journeys and approach, what were some of the triggers or what were some of the key moments that led you to be in that situation, but also what were some of the enablers that got you out? And then from there, we looked at how we could match that with the data that a particular organization had and some of the flags which they were capturing, but also some of the keywords, like some qualitative identifiers from research, which we then matched to some of the data and information which was collected on customers' profiles, but also in customers' interactions. So it could be chat transcripts, or it could be some of the service notes. And we use that to be able to get to a list of 90 identifiers. And those 90 identifiers were just across financial hardship and homelessness. I think we had an exhaustive list of over, I think, 240 across each of the vulnerabilities. And that's what's helped us get to that accuracy. But what was really, really critical is on the back of being able to identify and predict, how do we actually put in the right models of care on the back of that? Because we were actually predicting that people were going to become in homelessness, or we're identifying people that were in homelessness, which may not have seen themselves in that situation. And so it was really kind of challenging to think about the right models of care so that people felt supported, but also didn't feel like they were being targeted as vulnerable, vulnerable people when they didn't see themselves in that situation.
Okay, totally. Okay, thank you so much for that. I think, just to recap, there's so many questions I have with regards to. I mean, we're obviously living in a really sort of tough time at this moment in time, and definitely, I mean, not only does lockdown bring out all sorts of mental health issues, but also the fact of losing your job now. I think that puts you in another category as well. So, I mean, I could go on for days about this topic, because it's really a situation where it opens up doors and opens up avenues the more you go down the rabbit hole. But well done. I really appreciated the talk. I thought it was fantastic. I do think that, especially in this time, there's going to be a huge call out for people needing some advice and some guidance around this time. Okay. So thank you. And have a lovely day, or evening, I should say.
Thank you.
Take care, guys.
Thanks a lot.
Cheers. Appreciate it.